And welcome back to Urban Outlook. We are talking to Dr. Calvin Smith. He is a physician and professor at Meharry Medical College and also one of the supervisors that is working the testing centers for COVID-19 around Metro Nashville. We are talking, of course, about the disparity that we're seeing with African Americans and other people of color who are actually getting the coronavirus and dying from the coronavirus at higher rates than other groups. And so thank you so much, Dr. Smith, for being back with us the second half of the show. Before we left, you kind of talked about, the importance of people taking those precautions, of making sure they wear their masks, of practicing social distancing, of making sure that they wash their hands regularly. What else can people do to kind of make sure that they do the things they want to do, whether it's go to the grocery store or protest, but still keep themselves safe?
Well, the biggest thing that they can do is to go out and get tested. Knowing whether you are a positive carrier of COVID. And again, the information it changes day to day. But knowing whether you're a positive carrier of COVID-19 can make a big difference because you can self-quarantine and we can trace back who you've been in contact with and protect them as well. And it's free and open to the public. You don't have to have symptoms to be tested. And we encourage everybody to go out to one of the 3 testing sites that we have here in Middle Tennessee.
At one point, we were told, there weren't enough tests to go around. So make sure you wait and let the folks who are sick get tested first. But that has since then changed in the weeks that we've been dealing with this, correct?
Oh, absolutely. We saw a record number of patients yesterday, 442 at the Nissan Stadium site. And I assure you, we had enough tests to do twice that, and we get constant refills from the city, from our laboratory. So that's not a concern at all. You're not taking a test away from somebody who might potentially need it. By all means, please come to a testing site and get tested.
And there's some conversation also about the regular test and what that looks like. That's the swab that goes all the way up and kind of waters your eyes and gives you a sort of a taste for just a very quick second. And then there's some other questions about the antibodies testing. Can you talk a little bit about what all that means?
Sure. So the test that we perform at our center is the nasopharyngeal swab. I've had it done myself, and I describe it to the patients that I swab in a nature very much to what you said. It's not a comfortable test at all, and I don't want people to go into it thinking that it's going to be just for them. It's not going to be an easy test. It's not a good test. It's not, from that standpoint, it's not optimal. But that's what we have, and it's the most accurate test that we have so far. It's a little bit more accurate than even the rapid test. From what I've read, and I could be incorrect in that manner. But as far as the antibody testing is concerned, antibody testing shows whether you've been exposed to the virus and whether your body has, basically cleared it. And particularly the kind of antibody test that we're looking for is specific to COVID-19, SARS-2, which is the one that has caused this wreaked havoc here around the world. And that antibody test is slowly rolling out. It appears to be very accurate, very sensitive and specific are the terms that we use as doctors. But essentially what that boils down to is that it's accurate. It'll prove that you actually had that disease. And the likelihood is that most people will not get the disease again. Again, we don't know for sure. It's too new. But it seems that that's what the case is.
Mm-hmm. And as you and over at Meharry and the rest of your colleagues sort of look at the results of these tests, talk about the importance of this work and what that could mean when it comes to finding a cure or finding a vaccine, I guess is probably the more accurate way of saying that, so that we can sort of fight this moving forward.
Sure. So Dr. Hildreth here is a virologist, is the immunologist by training. So he's perfectly placed here for this situation. And one of his colleagues that continues to work in this industry, in that field, is Dr. Donald Alcindor. He's one of our researchers here and works in the health disparities and particularly about HIV research. And he did some groundbreaking research on the Zika virus that occurred a few years ago. Well, so happens that one of the medications that he was using for Zika that actually showed some good results is actually going to be pretty good for COVID. It works to help basically keep it from reproducing itself, keep it from replicating, keep it from making copies of itself throughout the body. And so far, so good with the work that Dr. Alcindor has done. It's been pretty promising. There have been other research institutions, people around the world working on it at the same time. One of the things that happens is that academic institutions in particular become competitive and, want to outdo each other, that's a good competition because it brings about a cure a little bit faster than what we would normally see.
Yeah, and I wondered about that time frame too. So a cure a little bit faster, but some say it will take it usually takes sometimes years to get the right mix of vaccine, right, to help. But you all,
Yeah.
what's the timeline on when we might have something out there? Is it that magical 12, 18 months that we've been hearing?
So it's two different things. There's a treatment, and then there's the vaccine. A treatment is much more likely to occur quicker. We're talking about a time period of months for a treatment, and a vaccine will probably take a little bit more time. In the scientific method, the way we do things, almost all of it has to be done following a particular method, and we have to make sure above all else that it is safe. So with that being said, it has to undergo certain trials. We have to make sure that it's safe for and not causing more harm than it is helpful. And that's usually the biggest, I don't want to say hold up, but that's usually the longest part of the process. But with treatments, generally because we're not, again, we're not working with viruses in their live forms or even in their ameliorated forms. We're dealing with actual medications and a lot of them have already been out on the market, and we're looking for alternative uses for them. So that tends to speed up their availability.
You look at the situation today, and again, as we talk about it, this changes every day where the numbers fluctuate so. But if you would give sort of a report card of such for Tennessee, if you will, what does it look like for us here? How is this virus impacting the people of our state? And what do you see moving forward?
I would give Tennessee a solid B to B plus. And the reason I do so is because, number one, we were pretty early adherers to the flattening the curve movement. People generally did a good job of, social distancing, wearing masks, especially in the Middle Tennessee area. Looking at the numbers, we don't have anywhere near the types of numbers as somewhere like New York. And granted, we don't have the population density of a place like that, but we did better than our neighbors. I'll put it that way. Okay. So I would say we did a B plus, and to continue, we have to keep doing those kind of things to keep going in that effort. The numbers did spike. I follow the numbers on my phone. The very first thing that I look at in the morning is Tennessee's numbers versus the nationwide numbers, and we saw a spike just like everybody else, but our spike was a little bit better. Our death numbers are a little bit lower, but ideally we don't want to have anybody dying. We don't want to have anybody sick with this.
Right, because one death is too many. So let's remind people then, and I think everybody should know by now because we've been having this conversation for so long, but let's just remind people again of the warning signs, the symptoms, what you should look for when you're coming down with the virus.
Sure. So a dry cough, chest pain, especially when breathing in and out, a loss of taste or smell, either one of those. So you're not able to smell those perfumes that somebody has on, and we're wearing masks, so it's a little bit different. But not being able to smell those things you normally are able to smell when you eat, not being able to taste the things that normally taste, very salty, sweet, whatever, what have you. And then fever. So those are the four big ones. And then there's some other things like shaking chills. There was the COVID toe or COVID rash of the feet, where people were having some discoloration, some redness in their feet. Diarrhea was another one that was pretty prevalent, and it was a bad sign if people had that. But the main four are the fever, the cough, the dry cough, the chest pain with breathing, and the loss of taste and smell.
And are our medical facilities, Dr. Smith, managing the folks that are coming in who are very, very sick? Are we able to handle those numbers of folks? And as we see perhaps these numbers spike, whether it's the projected increase we may see in the fall or winter months, or whether it's the outcome of the protests that we're seeing, do we have the capacity to handle the growth?
So the first part of it, yes, we are able to handle things right now. And we're still seeing steady cases like the hospital attached with Meharry Medical College, Nashville General Hospital, still does have a few cases. But we also have beds available for people who have other illnesses. So we're doing fine from that standpoint. With the spikes, again, there was a rush to try to get ventilators out, get additional beds. Our hospital has built an additional unit that will be able to treat patients with COVID. And so we're getting there. And that was one of the big hopes in flattening the curve, was to get other beds available, to get other facilities available. I believe that we would be able to handle it. If there is another spike, I think we'll be able to handle it a little bit better in a lot of instances. But we have to keep working at it and keep trying to keep the numbers as low as we can. We don't want to get to that point where we have an overflow, and then people who come in with heart attacks, who come in with strokes, aren't able to get a bed in the hospital.
There's a website, I'm sure, that has all of the locations of where people can get tested. Do you know that off the top of your head? And if not, we'll make sure we attach it to our News Channel 5 site.
I can definitely speak to the three in the city, in Davidson County,
Okay,
which are a joint effort between Meharry Medical College and the city. So there is the Nissan Stadium testing site, which is at Parking Lot N, which is located directly across the street from the stadium on Shelby / Korean Boulevard, Korean Vets Boulevard. There is the site in Antioch, which is located at the old Kmart on Murfreesboro Pike. And then there is the site at Meharry Medical College, which runs on 21st Avenue. You turn onto Hermosa Street and are fed through a straight line on 21st Avenue.
Perfect. Thank you so much, Dr. Calvin Smith. We appreciate you being with us today and keeping us abreast of all the things that we need to do to stay safe. And we appreciate you joining us. We'll see you again next time.